Hi, my name is Ariel Vincent and I'm going to perform the vital signs and pain assessment video. And we'll start off first with our 8 pre-procedural steps. The first step is you want to check your patient order sheet. Next, you want to gather all the supplies that you're going to need. Then you want to wash your hands to maintain standard precaution. Next, you're going to go into the room and introduce yourself and also check and make sure that it's the correct patient by identifying their name and their date of birth. Then you're going to close the door for privacy or close the curtain. After that, you are going to explain the procedure, whatever you're going to do to them, and then you're going to lift the bed to the right height. Now we're going to go in and get started. Hi, my name is Ariel. I'm going to be your student nurse for the day. Could I get your name and your date of birth, please?
Angela Locksmith, 0302-1995.
Okay, and then I'm just going to verify it on your wristband to make sure that it's you. Wonderful. So, I heard you've come in having some pain. Could you tell me where?
It's my right calf.
Your right calf? Okay. And when did this start for you?
The other day after I was done running 3 miles.
Done running 3 miles? Okay. Now, could you describe the pain? Is it sharp? Is it dull? Is it achy?
It's dull.
It's dull? Okay.
Yeah.
And on a scale of 0 to 10, 0 being no pain at all, 10 being the worst pain you've had in your life, what would you rate your pain?
I would say it's probably a 3.
Probably a 3?
Mm-hmm.
Okay. And now, does it radiate anywhere? Does it go up your leg or down your leg?
No.
No? And is it constant or is it intermittent? Does it come and go?
It comes and goes.
It comes and goes? All right. And are you having any pain currently right now?
I'm not.
You're not? Okay. So after getting this assessment, we're going to go ahead and do your vital signs, and then we'll go from there.
Okay.
Awesome.
Thank you.
You're welcome. So now I am going to perform the vital signs portion of my assessment and using my patient. I'm going to start off with the temperature. A normal adult temperature is 96.4 to 99.1. A normal pediatric temperature would be 95.5 to 99.5. And first, I would have my patient making sure they're sitting up. I would place my thermometer in the posterior right or left sublingual pocket in their mouth, hold it, and wait till I get a temperature. Normally, if a patient was smoking or drank any liquids, I would wait 15 minutes before obtaining a temperature. After this, I'm going to go into the pulse. I would, on a human, find the right radial pulse underneath the thumb, and I would hold and count for 30 seconds. A normal pulse rate for an adult is 50 to 95 beats per minute, and for a pediatric patient, it would be 70 to 100 beats per minute. If the pulse was regular, I would count for 30 seconds and multiply that by 2. If I found an irregular pulse, I would count for 60 seconds. As I was counting the pulse, I would also check for respirations, making sure that their chest would rise and fall normal. And a normal pulse or a normal respiration rate would be 10 to 20 for an adult, and for a peds patient, it would be 18 to 24. If I noticed that the patient's breathing was labored or they were using their accessory muscles, I would assess the respirations for 60 seconds, and also I would use an O2 sat. After the pulse rate and the respirations, I would do checking a blood pressure. The normal adult blood pressure range is 120 over 80, and then the peds would be 95 over 60. So first off, I would take my blood pressure cuff and I would measure to make sure that it fit the patient's arm, making sure that it was half the diameter of their bicep. And then I would put it on comfortably, making sure that I line up the arrow with their left arm, their left brachial artery. And I would place it on the patient. This one's a very furry patient. I would make sure that the cuff also was 1 inch above the antecubital fossa. After checking their radial pulse, I would check for 30 seconds and I would inflate the cuff. And once I did not feel their radial pulse anymore, I would know that that would be my approximate systolic number. I would place my stethoscope in, and I would place this, first off feeling the brachial pulse with my fingers. I would place my stethoscope on the brachial pulse. It should be kind of snug underneath the blood pressure cuff. And I would inflate the cuff, and wait till I hear the first beat, and I would inflate the cuff probably 10 to 20 points above the approximate systolic number that I had received earlier. And I would wait, and then I would count to get my systolic and my diastolic accurately. And one reason that you would not be able to use the arm for a patient is if they've had a mastectomy, either single or double. If a double, you would have to use a calf. If they had a single mastectomy on their right side, then you would use their left arm, and vice versa. And so that is the end of the vital assessment video. And to add to my pain assessment video, if my patient did report pain, I would make sure to look in the chart and make sure that I would get any medications that the doctor prescribed for them, and let them know that I would be back within a certain amount of time frame. So now that we've finished the assessment, the 6 post-procedural steps are: first off, I had to lower the bed to the lowest height, make sure that the wheels are locked, put 2 of the side bed rails up, and also make sure that the patient's call light is within reach. Then I assess the patient for any additional needs and let them know my time of return. After that, I will dispose of PPE properly. Then I will make sure that I clean my stethoscope or anything that I use to come in contact with the patient. Then I will wash my hands. And last but not least, I will document. I'll make sure I document the time, the day, the procedure that I performed, any vital signs, and also the response to the patient from the procedure.